Thank you, Mr Speaker. Number 1, please.
Minister Tomlinson.
Thank you, Mr Speaker. Our new JET scheme has started rolling out across the country and blasted off in my honourable friend's constituency on the 5th of October. The scheme has £238 million funding that is dedicated to helping those people who have been out of work for 3 or more months and may be at risk of long-term unemployment. JETS will see a variety of providers work with our local job centre networks to offer a range of bespoke services, including important advice on how people can move into new growing sectors, as well as help with CV building and interview coaching.
Thank you, Mr Speaker, and I thank my honourable friend for that answer, and I'm glad that the scheme is already helping my constituents in Penistone and Stocksbridge, many of whom are now struggling to find work as a result of the pandemic. But getting people back into work will require a national effort, so can the Minister provide a broader update on the rollout of the scheme?
Mr Tomlinson.
My honourable friend is right to suggest tackling the impacts of COVID will require a national effort, and DWP stands ready to deliver this with our network of local job centres, which will be expanding. JET started 2 weeks ago and is now live right across England and Wales. We are contracting anew in Scotland, and as the scheme continues to roll out across Great Britain, we anticipate JETS will help 280,000 of our claimants find work and build the skills to pivot into new sectors if required. With permission, I'd like to answer question 21 and 22 together. Earlier this year, we suspended face-to-face assessments. This suspension is still in place and is kept under review in line with the latest public health guidance.
Mr Speaker, the Joseph Rowntree Foundation estimates that 1.3 million people across Scotland will lose out if the DWP does not make the £20 increase to universal credit permanent and extend this to legacy benefits. Resolution Foundation also report that 1 in 3 working-age families in the so-called Red Wall constituencies will be £1,000 a year worse off if the planned cuts to universal credit go ahead. How exactly is this levelling up?
Minister.
I refer the honourable member to the answer the Minister for Welfare Delivery has already given. The Government has introduced a package of temporary welfare measures worth £9.3 billion this year to help with the financial consequences of the pandemic.
Heading up to Scotland with Kirstin Oswald. Kirstin Oswald.
Thank you, Mr Speaker. More than ever, with millions facing unemployment and reduced hours of earnings, our social security system must be properly funded. Joseph Rowntree Foundation has rightly pointed out that cutting social security takes money out of the economy by reducing consumer spending. If the Minister isn't yet convinced that cutting universal credit is grossly unjust, can he at least consider making this permanent to stimulate the economy?
Minister.
Well, the honourable member, as I've just set out, we as a government have shown through our £9.3 billion worth of temporary support, which we continue to keep under review, but we have shown throughout these unprecedented times that we will be flexible, we will provide the support, including our comprehensive £30 billion plan for jobs, to make sure we're standing side by those as they navigate the challenges of COVID.
Number 25, Mr Speaker.
Mr Tomlinson.
By law, benefit levels must be reviewed annually to determine if they are at the appropriate level. The most recent review resulted in an uprating of 1.7%. On disability benefits specifically, spending this year has increased by almost 5% from £19 billion to £20 billion.
Dr James Davies.
I thank the Minister for that reply. Recently, I was pleased to meet my constituent, Tony Davis, who sadly lives with motor neurone disease. On behalf of Tony and the MND Association community, I wonder if the Minister would kindly announce when he's likely to publish the outcome of the review into access for benefits for the terminally ill. Thank you.
Minister.
We have been very clear following our comprehensive review that there will be 3 themes. We will change the 6-month rule, we will improve consistency, and we will raise awareness of the support available. Only last week I met myself with MND and with the Minister for Prevention, Public Health and Primary Care as we work at great speed to bring forward those much needed changes.
Minister.
As a government, we are proud that 1.3 million more disabled people are in work since 2013, a record high. We continue to offer support through the Work and Health Programme, IPES, Disability Confident and Access to Work.
Mr Speaker, the disability employment gap in my constituency of Aylesbury is currently 25.4%, and there are concerns that this will widen as the economy suffers from the impact of COVID. What reassurance can my honourable friend give me that disabled people will get the specific help they need to find work, for example through tailored support or the funding of reasonable adjustments on the Kickstart scheme?
Minister.
It's absolutely the case that access to work is available and works hand in hand in schemes such as Kickstart, so that reasonable adjustments can be made for disabled employees. And I have written to disability confident leaders encouraging them to sign up to Kickstart.
Mr Speaker, Knaresborough Connectors Community Group and Knaresborough Chamber of Trade are working together to build a scheme enabling participation in Kickstart for smaller businesses in the area. It's good work and I'm very keen to help it. Will my right honourable friend be encouraging the department to work with local community organisations to ensure that all areas, urban and rural, all businesses, small and large, can access the benefits of Kickstart?
My honourable friend is always a champion of his local organisations and constituents, so yes, absolutely. Many local authorities and charities and organisations such as the North Yorkshire County Council have already agreed to act as gateways or submitted bids for funding.
Many disabled people have lost carers and are struggling to employ replacements during the COVID crisis, and this can mean that they lose vital support when applying for benefits. I spoke to a constituent today who flagged up to me that there is nowhere to indicate on the system that you're somebody with a high support need, so that extra care is taken when they're dealing with your application. And she's missed out on a benefit deadline because of that. So can we look into this and help disabled people when they're applying for benefits?
Important point. In our forthcoming Green Paper, we will be looking specifically at the importance of advocacy in the system and increasing that. At the initial application, it should have been identified, and I'm happy if the honourable member will send through the details to make sure that that claimant isn't being lost from the system.
My constituent Joseph made a claim for industrial injuries disablement benefit in January. His assessment, along with all the other new assessments, was postponed because of COVID. So he's living with the extra costs that come with having an industrial disease, but he hasn't got the extra benefits that he needs. Can the Secretary of State please urgently resume IIDB assessments?
I thank my honourable member. I'm very much aware of this. As he will understand, we suspended face-to-face assessments across all disability benefits following the public health guidance. We are working as quickly as we can to roll out telephone assessments where possible with IIDB, and as soon as it is safe to do so, we will return to face-to-face assessments.
In order to